Hi everyone, my name is Natalia Castañeda. This is my presentation titled Implementing Psychedelic-Assisted Therapy. So to start off, psychedelic-assisted psychotherapy, or also known as PAP, combines structured psychotherapy with supervised use of psychedelic substances. The model typically includes three phases: a preparation phase, a monitored dosing session, and an integration phase. It is often used for treatment-resistant conditions such as PTSD or major depressive disorder, and research has shown promising outcomes for these conditions when using PAP. However, it is important to note that implementation of PAP into widespread practice does require careful systematic planning and strong ethical safeguards. With that said, although PAP shows clinical promise, it is highly resource intensive and therefore there are some systemic challenges. For example, sessions can last 6 to 8 hours and they require extensive preparation and follow up. Overall, the US healthcare system is structured around brief appointments, which can make PAP integration challenging. There are also other systemic challenges of incorporating PAP into the current US medical and mental health system, such as training requirements, cost and insurance coverage, accessibility, and equity. So the first systemic challenge that I mentioned was cost and insurance coverage. The lengthy nature of PAP sessions reduces the number of clients a provider can treat each day, and it increases provider cost. Also, most insurance reimbursement structures do not cover 6 to 8 hour therapeutic sessions. Therefore, people without insurance coverage may not have access to PAP because of this. These factors therefore help create an issue where PAP is only accessible to individuals who can pay out of pocket, which potentially worsens the already existing inequities in mental health care. A way that we can begin to address these issues is through policy reform, insurance advocacy, and implementing outcome-based reimbursement models. So the second systemic challenge we discussed was training requirements. Because PAP requires therapists to understand altered mental states, trauma-informed care, risk management, and pharmacology, these all require specialized training. Unfortunately, there are a limited number of training and certification programs, and training programs are not standardized. These factors are an issue because they could compromise client safety. A way that we can begin to combat this is to develop national training standards and continuing education requirements for PAP. Lastly, the third systemic challenge is accessibility and equity. Historically, marginalized communities often face greater barriers when it comes to accessing innovative treatments like PAP. One issue is geographic access. Since many services are concentrated in urban or specialized clinical settings, it makes it harder for people in rural or underserved areas to reach these. Another barrier is a significant time commitment required for PAP. The process often includes screening, preparation sessions, the dosing session, and the follow-up integration sessions that are done over the course of several weeks. For individuals who cannot easily take time off work, arrange transportation, or find childcare, this level of commitment can make participation get difficult. This, therefore, is causing an issue with widening mental health disparities through these communities. So a way to help address these challenges is by developing community partnerships, offering sliding scale payment options, and ensuring more inclusive representation in research and clinical care. These steps can help promote more equitable access to PAP. Next, we need to discuss how safety and ethics are essential for the responsible implementation of psychedelic-assisted therapy. Because clients enter altered and often vulnerable states during sessions, it is crucial that structured protocols are in place to support and protect them. Ethical practices should prioritize client autonomy, informed consent, transparency, and clear professional boundaries. In addition, therapists must be mindful of cultural awareness and use trauma-informed approaches to ensure that care is respectful, safe, and supportive for each client. So some key safety measures in psychedelic-assisted therapy that we need to discuss include therapist preparation, informed consent, and thorough client screening. First, therapist preparation is essential. Clinicians need specialized training in PAP and must understand how to respond to trauma reactions, provide grounding support, and manage potential crisis during sessions. Ongoing supervision and peer consultation are also important to help maintain ethical practice and clinical competence. Second, informed consent in PAP goes beyond standard therapy consent. Clients need to clearly understand the potential risk, the emotional intensity of the experience, and any potential long-term side effects. It's also important to be transparent about confidentiality and legal considerations, which also help support client autonomy and trust. Finally, comprehensive medical and psychological screenings help protect clients because these evaluations can help identify anything that can cause potential harm to the client, such as certain psychiatric conditions or medication interactions that could occur. This careful screening process ensures that only appropriate candidates move forward with dosing sessions. Lastly, there are important ethical considerations that we need to discuss, such as professional boundaries and cultural humility. Boundaries are especially important in psychedelic assisted therapy because clients may be in highly vulnerable and emotionally open states during sessions. Clear guidelines around physical contact, dual relationships, and the overall structure of sessions help protect both the client and the therapist. Professional ethical codes, such as those established by the American Psychological Association and the American Counseling Association, emphasize the importance of maintaining these therapeutic boundaries. Next, cultural humility is another key consideration. Many psychedelic practices have roots in indigenous and traditional healing traditions, and because of this, providers should acknowledge these origins and be mindful of avoiding cultural appropriation. Practicing cultural humility also involves ongoing self reflection about personal beliefs and biases, privileges, and cultural awareness. Taking these steps helps ensure that care is more respectful, inclusive, and empathically implemented for the client. And lastly, I'd just like to say thank you all so much for watching.